Hi, class. This is Dr. Weaver. I want to go ahead and make another video voiceover. The topic that I will be discussing with you has to do with effective delegation and also supervision. We are going to discuss slides 1 through, I believe, 17 in class, which that shouldn't take too long. However, for the purpose of this video, we will start around slide 18, and I think it's probably less than 10 slides for me to go over. But again, as you know, it does allow me to not have to feel like I'm rushed in class. All right, so let's go ahead and get started. Of course, I will go over an introduction to this topic in class. But again, the thing to keep in mind is that we have to understand how to properly delegate. Just think about it. And I probably mentioned this in class as well. You cannot have a floor just full of RNs. All right. It is not cost effective, and so organizations, they typically use unlicensed assistive personnel who are typically certified because they're certified as a tech. They just don't have a license like an RN, obviously. But we have these techs. We call them patient care techs. Sometimes I guess they may call them nursing assistants these days, or assistive personnel, as I mentioned earlier. These folks, they can carry out, of course, certain tasks safely, as long as they are under the supervision of the registered nurse. And it is cost effective. Of course, and I hate to say this, but when you think about what they're paid as opposed to what a registered nurse is paid, then of course it makes sense, especially to an organization, to have a mixture of RNs as well as qualified assistive personnel that can take directions and do their jobs well. So, but strangely enough, even with that, saying that, hospitals still try to minimize the amount of assistive personnel on the floor. So what I usually find is that you have a certain amount of, you have that nurse-patient ratio, depending on the type of floor is on, and you might get one tech, all right? And even that tech carries out very little. They may help you with baths and things like that. They may, go get your blood or take your blood to the lab. They may even make them sitters for the night. But what I'm saying is that we typically don't have even enough unlicensed assisted personnel on the floor, which is not a good thing in my opinion. All right, because that actually makes each nurse depend on one another to assist with their patient's care, and that nurse may be already tied up with their own work. So something to keep in mind. Let me go ahead and start sharing my presentation. So as I said, we're going to start with slide 18, and this talks about the 5 rights of delegation. Make sure I'm sharing. Let's see, screen 2 and allow. All right, so you should be seeing slide 18, 5 rights of delegation. Think about, right now, as far as the rights of medication administration, used to be 5, and now I think is up to as much as 9. So it just seems to vary depending on the source that you are looking at. So consider this similar in that respect. It's just a way to make us to understand what the rules are in this case concerning proper delegation. All right. So one method to avoid high-risk delegation and simplify the delegation process is referred to as the 5 rights of delegation. And this is by the NCSBA and as well as the ANA, who has provided this information to us. The first one is the right task. All right, what does this mean? Ensure that the delegated task conform to the organization's established policies and procedures for performing the particular task. So the question is the task written in the policies and procedures? And if so, then it can become, as long as it's done in the way that it is outlined in the policies and procedures, it is a proper task, all right, a legitimate task. The next one is the right circumstances. The clinical condition of the patient should be stable, and delegated tasks should not require independent nursing judgment. And that's the key. If it requires independent nursing judgment, which you guys will have, of course, you're getting a lot of education that will allow you to independently use nursing judgment. This is something that you will not delegate. All right. But if it does not, if the situation does not require independent nursing judgment, then it can be safely delegated. Any change in the patient's condition must be reported immediately to the RN. And these are instructions that has to be given to the unlicensed assistant personnel that if the patient's condition changes, for example, if the patient's blood pressure just drops significantly, or the respiratory rates, not that you're asking the unlicensed assisted personnel to assess the patient, but I mean, it's pretty easy to know if a patient is in distress. And that's all they have to report to the RN, that the patient is in some kind of distress. The third one is the right person. Delegate to someone who has the appropriate knowledge and skills to perform the activity. And of course, we do train our APs. We do train them. And so we try to give them the appropriate knowledge and skills and what have you in order to perform the task assigned. All right. The fourth one is the right direction and communication. What this means is to give clear explanation about the task. All right. The data that is to be collected and what are the expected outcomes. Also allow the delegatee to ask clarifying questions. If they don't understand what is being delegated, allow them to ask questions. And indicate when the delegatee should report back to the RN. I want you to go in and take this temperature, take the patient's vital signs, and let me know if something is, if the patient is unstable, if you will, that the vitals are unstable or they are abnormal, if you will. And of course, that person, the delegatee, reports back to you. And of course, you go in and assess. The delegatee should also understand that he or she cannot make any modifications in carrying out the task without first consulting with the RN. And so even if the task, even if it's something that appears to be common sense, and the delegatee is attempted to change the task, the delegated task, they should not do so. This should be something that should be provided to the RN and allow the RN to make that judgment call. The fifth one is the right supervision and evaluation. All right, the RN delegator is responsible for following up with the delegatee when the activity is completed and evaluating the patient outcomes. And so you just cannot delegate and just walk away from the situation altogether. You have to go back, you have to assess, reassess to make sure that the patient is doing well. Right. Invite also feedback to assess how the delegation process is working and how to improve the process. Maybe you think you're doing all things well, but perhaps if someone points out to you that, hey, you may want to think about this or the other. Hey, if someone has a great idea, I'm open ears, because anything that can, number one, keep the patient safe, and also save, my license, can say that the organization, any kind of reliability, then I'm all open for that. So feedback is always important. RNs can prevent being placed into unsafe, risky delegation situations by adhering to the safe delegation practices recommended in this chapter, of course. And this is something that you guys really need to hone in on and understand it very well, because you are going to be delegating tasks to APs in the clinical setting. All right. Now, as far as supervision is concerned, what is supervision? The AMA defines supervision as the active process of directing, guiding, and influencing the outcome of an individual's performance of a task, the delegatee. Supervision may be categorized as on-site. And what does this mean? This means that the nurse is physically present on site, right, or immediately available while the activity is being performed, or off-site, in which the nurse has the ability to provide direction through various means of written, verbal, and electronic communication. Now, in terms of the on-site supervision, it generally occurs in, as far as settings are concerned, acute care or ambulatory care settings where the RN is immediately available. And of course, if we're talking about off-site supervision, think about home care practices, community settings or whatnot. You might work in, for example, a remote center where, what do they call it, telehealth. That's something that can be considered in the community, where you're monitoring the patient, but remotely. And also long-term care facilities as well are considered off-site supervision. Let's talk about the levels of supervision. There are a few levels. Let me see something. Yeah. There is the unsupervised supervision. There's also initial direction and periodic inspection. And the third one is continuous supervision. Right. Now, various levels of supervision may be required on the basis of the task that is delegated, and the education, of course, the experience, how competent one is, and also the working relationship of the people who are involved. How well do you know them? Do you know them to be safe and judicious and prudent and what have you? As far as unsupervised, what that means is one RN is working with another RN in a collegial relationship, and neither RN is in the position of supervising the other. You just co-workers working together, right? Now, each RN is responsible and accountable for his or her own practice or assignment. However, the RN in a supervisory or management position, for example, a team leader, a charge nurse, a nurse manager, as defined by the healthcare organization where you work, will be in a position to supervise other RNs. All right. Then there's the initial direction and or periodic inspection. This means that the RN supervises a licensed caregiver, for example, an LPN or an assisted personnel. They also know the person's training and competencies. Again, you know these folks. You know that They know how to perform the various tasks, and they're safe. Also has developed a working relationship with the staff member. So, for example, the nurse, the RN, has been working with the nursing assistant for 6 months, right? And is comfortable in giving initial directions for a delegated task, and also follow up with the assistant once during the shift, just to make sure, or you want to evaluate the situation just to make sure that, again, the patient is safe. And then you have continuous supervision. The RN has determined that the delegatee needs frequent to continual support and assistance. Maybe someone who is new. All right. This level of supervision is required when even the working relationship is new. The task may be very complex, or the delegatee is inexperienced or has not demonstrated an acceptable level of competence. And so you really have to begin to understand, to learn about your those who you delegate the various tasks to. And hopefully over time, you'll be able to do that. You'll be able to know who is who's safe, who is not safe, and delegate accordingly. And so that will be certainly important. As far as assigning a task, or even someone who's responsible for an assignment of patients on the floor or in a unit versus delegating, and the two are different. Now, assigning tasks is not the same as delegating a task. Assignment is the routine care, activities and procedures that are within the authorized scope of the practice of the RN or the LPN, or part of the routine functions of the assistant personnel. These are things that you are hired to do, right? Like the RN is delegation. You don't delegate for an RN to go do an assessment, because that's part of the job description. This is what they do, all right? An LPN can, of course, carry out a certain task. Let's say they're going in to pass medications. Well, that's probably a part of their job, right? Doesn't have to be delegated. Or the assistant personnel may go in and give a bath, or pass out trays, or something like that. It's all a part of their job. And so this is not delegating. It's just a part of again, the job description. Now, an assignment designates those activities that a staff member is responsible for performing as a condition of employment. All right, this is what they were hired to do. And is consistent with the staff member's job position, and, as I mentioned, job description, their legal scope of practice, as noted, of course, in the Nurse Practice Act. Also, the training and educational background is all a part of this, being able to assign a task safely. The staff member assumes also responsibility and is accountable for completing the assignment that has been given to them as well. Let's talk about some assignment considerations. Now, assigning groups of patients to various providers to include an assisted personnel, LPNs or LVNs is what I think they call them out in California. This is not appropriate. You do not assign. You don't assign them to a group necessarily of patients. So, for example, an assisted personnel cannot be assigned to a patient or group of patients, but rather should be assigned to an RN. All right. The assisted personnel or tech Joni is going to be assigned to Robert, who's the RN. All right, who will delegate certain tasks, but of course, again, as was mentioned, they're routine tasks that they were also hired to do. That they're not really per se delegated again, but it's just a part of their routine jobs. All right. Typical assignments for assisted personnel include, for example, passing out trays. I mentioned that earlier. Assisting patients with activities of daily living. This is a part of the job description. This is what they're hired for. Transporting patients, stocking supplies. These things do not need to be delegated. And completing delegated tasks for the RN. It all falls under that umbrella of an assignment. The LPN or the LVN may be assigned specific patients for whom to perform a care, but the RN remains responsible for all nursing practice activities, including patient assessment, care planning, and also patient teaching. I'm not sure if you guys have run into this yet, but when you're doing clinical, you probably have witnessed a combination of RNs, LPNs, as well as assisted personnel on the floor. And the RN and the LPN, actually, they are assigned a group of patients and whatnot. But still, there are those tasks that the RN must still delegate to the LPN. The LPN is just not on their own. One of the things I wanted to bring out, they're not on their own. Even though they can take a patient assignment, an RN is still responsible for certain aspects of the patient's care. Typically on the floor, the LPN cannot admit patients. That has to be the RN because it does require an assessment. They cannot hang blood. There's just certain things they cannot do. There was a time they couldn't IV push certain medications, and that could have changed by now, but I kind of doubt it. All right. All right, that's all I'll say about that. Responsible. I think I may have lost. No, I guess I didn't. I thought I lost my place. Just make sure. All right. So we're continuing the discussion about assignment considerations. The RN is also responsible for assignments made to personnel in the clinical setting, right? Which as an RNs, we're still overseeing, the assignments that are given to those who, for example, the LPN and the assisted personnel. Now, several factors should be considered when making assignments. So one of the things to think about, one of several, is the patient's physiologic status and also complexity of care. And so what this means is when you're making that assignment or when you're delegating those tasks, think about the patient, how complex the patient is. What is their status? Are their vital signs unstable? All right. Is the patient's condition changing rapidly? These are patients you may not want to delegate tasks to because it will require such nursing judgment on the part of the LPN and the assisted personnel. And so you have to be careful about assigning these types of patients because they don't have the educational level of the training to manage these types of patients. Something else to think about is, does the patient have multi-system involvement? Is the patient in respiratory failure and renal failure and liver failure? That's a pretty complex patient that you must consider before making assignments. All right. Does the patient need extensive health education? Again, would require an RN who has more extensive knowledge, right? Does the patient need extensive emotional support? What technology is involved in the care? For example, cardiac monitoring, IV pumps, or patient-controlled analgesia pumps. I don't necessarily call those well, I wouldn't consider those technologies that are difficult to manage. I'm thinking more about things like the ECMO system or the balloon pump or the CRRT system. These are some pretty complex pieces of technology that require specialized training, by the way. Now, patients with more unstable physiologic status or complex care requirements, they need a high level of skilled care. And so, if anything, we'll certainly have to remain with someone if you have someone who's have the education, and training or the skills to manage these types of patients, and cannot quite be delegated. That's not to say that everything, but you just have to really, as the RN, monitor these patients very carefully and assess and reassess and reassess, and making sure that you're revising your plan of care and reassessing and evaluating and just determining where the patient is. All right. There's also infection control is something to consider. To what extent are isolation procedures required? All right. There are some patients, because of the disease, the infectious disease that they have, donning all that, the PPE and what have you, is very time consuming. All right. Also, which patients should be adversely or could be adversely affected as a result of cross-contamination, right? So, for example, a new patient is admitted with a history of night sweats and chronic cough, all right? And the results of a sputum culture are pending. Think about like TB, right? Or some other communicable disease even. Now, all right, so you got that patient. And then think about another patient on the unit who's admitted with complications resulting from chemotherapy. Now, think about chemotherapy. Chemotherapy destroys the good stuff and the bad stuff, right? The bad stuff meaning the cancer, but it also destroys red blood cells. It destroys platelets as well as your white blood cells. And, of course, if it destroys your white blood cells, these patients are more susceptible to infection. And so you don't want to, you have to be careful about assigning this patient whose results are pending as far as whatever they have. You're assigning the nurse taking care of that patient with the patient who has a compromised immune system, and that can cause some cross-contamination and can actually kill the patient who's immune compromised. So you have to be really careful about assigning tasks to those patients, or to those nurses, if you will, right? Also, the degree of supervision is another thing that must be considered. So what level of supervision, direct or indirect, is required on the basis of a staff member's education, their experience, skill level, as well as competence? Is the appropriate supervision available? All right. The RN on call, sometimes they have nurses on call who they will call in if, let's say, if someone else calls out or the patient census spikes, and so they have RNs who are on call who works on the weekend. Now, they may require more supervision than an LPN who has worked in the unit full time and has demonstrated competence in caring for the patient population on the unit. And you do have those situations. Someone who's been there for a while versus someone who's just there occasionally, all right, and who don't have the amount of repetition or touches in terms of those types of patients. They may need more, of course, supervision. All right. Note that the most experienced skilled staff member should not be exclusively assigned to the most complex and difficult cases. This is something that I have noted for years. It's like the charge nurse always gives certain patients, right? Say a patient who's on a balloon pump, or they on CRRT, and they always assign these types of patients to one particular skilled staff. Now, think about one of these days if that particular skilled staff goes on vacation, or they have to call out because they're sick or injured, right? Or there's quite a few of these complex patients on the floor, and they can only take care of one group. They can't be everywhere, right? So that leaves the unit at a disadvantage. Assignments should be used as a staff development tool. What this means is that the charge nurse or the team leader should use these opportunities to take that less experienced person, assign them of this person to that group of complex patients, and help train them, help develop them. And that way, if you continue this procedure, if you will, or this process, the more skilled and qualified clinicians you will have on the unit who can take care of just about anybody, right? Assigning a less experienced nurse to a more complex patient, but at the same time increasing the level of supervision. In other words, the charge nurse should still assign the less experienced to that complex patient, but increase the level of supervision. This increases that nurse's skill level. All right, it makes them more competent. And confidence while maintaining safe and effective patient care, because the charge nurse is there, is mentoring, precepting, training this person, improving their confidence level, and at the same time, even though this person is less experienced, they have the more experienced nurse, charge nurse, who is there to ensure that the care, a safe and effective care, is being delivered. All right. But yeah, this is something that I have seen for years. And you know what really gets to me, used to really make me upset, is that, as I said previously, that one of these days you may have multiple patients up there. Like, think about during COVID, right? Probably several patients on the floor were on CRRT, which is a continuous renal replacement therapy, right? It's like a dialysis machine, but the dialysis is provided over a 24-hour period instead of the traditional peritoneal dialysis or the hemodialysis, where you have an AV fistula in your in some parts of your body. Anyway, just think if the charge nurse used that process very frequently, where they always assigned the complicated patients to certain people, and then COVID came, right? And then all these patients required CRRT. Let's say if you have 5 of them. Usually, let's say the floor may have 2 or 3, but now you have 5, 6, or 7 of them, right? And so you're setting yourself up for failure as a team leader or charge nurse. You're placing the well, first and foremost, you're placing the patient at risk, because you're going to have to assign a nurse to that patient, but then they will be less skilled, less competent, and that can cause a lot of problems. And so I hope that you guys will not be that type of team leader. It does require you getting off your backside, right? And mentoring and precepting this less competent nurse in order to make them more competent. So hopefully you guys won't fall into that same kind of situation, if you will. All right. Novice nurses, barriers to effective delegation. Many of you are going to be new nurses on the floor, and you're probably going to feel pretty uncomfortable about delegating. because you're new and you have other people who've been there for a while. And, sometimes they will let you know that, hey, I've been here all this time. Who are you? But guess what? You still have, that is not to say that you will ignore them, but it's a way to handle just about anything in a tactful and a professional way, because there are many things that they can contribute to in a way that will really help take care of the patient. And so it's more that collaboration, that working together, that professionalism, being tactful and so forth, for the sake of the patient, right, and the unit. Okay. As far as building delegation and supervision skills, now effective delegation and supervision are underlying qualities for the success of working with others efficiently and being able to provide safe, cost-effective care to our patients. Now, delegating can be very difficult, especially for a new nurse. All right. Some of the struggles the nurse has are the fear of being disliked. They may fear that they have a fear of making mistakes, and you will, actually. Also, inexperience in working with APs or the assisted personnel, LPNs or LVNs. The novice nurse may also have lack of confidence, lack of knowledge of the delegation process itself. And this is why you're learning the process now. This is why this is so important. You will find yourself in this situation. You will find yourself as the delegator to delegatees. And so really listen up, right? Now, because delegation and supervision involve interaction between two people, the RN needs to develop strong interpersonal skills and a supportive work environment to guarantee effective delegation and supervision situations. All right, so if you're that introvert, that person who likes to be by yourself and not deal with people, you're in the wrong job, right, or the wrong profession. And so you have to have great interpersonal skills. You have to be able to deal with people. And work with people and collaborate in groups and so forth in order to maximize the patient's outcomes, positive outcomes. Communicate effectively. And we've talked about effective communication, I believe, last week. Extremely important, even in the delegation process. Now, clear communication is key to successful delegation as well as supervision. You have to be able to communicate. The first step toward effective communication is for the RN to know exactly what needs to be done and what outcomes are expected. All right. So, for example, what is the specific task to be done? And for whom is the task to be done for? Now, maintaining self-control and confidence is an important communication skill because people can tell when you're not confident, when you lack a self-control. And so these are some attributes that you must obtain and maintain. New RNs often have expressed concerns about delegating to more seasoned LPNs or APs. You're going to find some LPNs, especially APs, who have been on some of these units for probably well over a decade, all right? And you feel like, what in the world can I tell this person? Trust me, you can and you will, right? Someone might say, I've been working on here for 12 years and I don't need you telling me what to do. Might be a typical response from directed to a novice nurse. Now, and of course, your reaction might be one of, let me get them back for saying that or for talking to me that way. However, the RN's correct response is to maintain composure. I know that's very difficult to do when someone comes at you like that. And also maintain that confidence and remain positive, all right? Because the work has to get done. And animosity, retaliation and what have you. It's just not the proper way to respond. Right? You can respond saying something along the lines of, I really appreciate your experience and knowledge, and I need you to help our team and patients by, and describe the task, whatever it is. And so this takes the focus off of who's been there longer, and on the patient. You're also acknowledging this person's experience and knowledge as well, which has a way of de-escalating situations, right? It's all about the patients. It's about the teams. It's about the overall patient outcomes on a particular unit. Always important, right? It is also important to listen carefully to the delegatee's response. Did the delegatee appear to listen and understand the directions, or were they their minds off into la la land their mind is on them getting ready to go on vacation, or I want to look at this catalog or get online and play a game or whatever? Were they really listening? Are they in tune to what you were discussing with them? Did he or she appear hesitant to accept the task? That may be a sign for you to dig in deeper, to evaluate even more closely to maybe this person has reservations about that task because they just don't know how to do it. And so, pick up on that body language, right? It says more. We talked about that. Does the person, the delegatee, appear angry? Are they did they show an uninterested, or are they uninterested? Or also, are they frustrated? All right. If a delegation action elicits a negative response from the delegatee, the nurse should ask for feedback using open-ended, non-threatening statements such as, you seem unsure about performing this task. See, that sounds more like that therapeutic communication that you learn in psych, if you've had it already. If you haven't, then you'll know what I mean once you take psych nursing. This sounds more therapeutic, all right? And you'll go through this therapeutic process in that particular course. The RN should always provide an opportunity for the delegatee to ask questions. That's very important to get that feedback, because you don't know how helpful that feedback might be to the patient's care. Create an environment of trust and cooperation. All right. So staff members will report problems more quickly. All right, more quickly if they know that the reaction from the supervisor will be non-threatening and non-judgmental. And so this is something that we as supervisors, managers, team leaders, or what have you, our reactions has to be one of non-threatening and non-judgmental. Then people will be more willing to share things with you. When mistakes occur, all right, the person making it should not be blamed or criticized, right? Rather, the supervisor should look for the root causes or systems issues. It could be a systems issue that needs to be changed. It may not necessarily be the individual, right, the worker. It could be that the system is flawed and it needs to be changed, such as inadequate training or an excessive workload. Those are systems issues. Those can be the root causes of why the patient had an adverse outcome. And of course, knowing what the cause is will allow folks to come together, brainstorm, try to figure out a better work process, if you will. Encouraging staff members to report and discuss problems is an excellent method of improving patient care and maintaining a helpful, supportive attitude. I believe when we were in class, I don't know which week it was, but we talked about, there was a term I couldn't quite remember, but we call it a kind of a blame-free environment. and it slipped me again. But basically, again, you are not. You're not casting blame, a judgment, threatening behavior. You're not exhibiting these things, these characteristics, and this causes people to report misses and near misses, right? Problems that actually occurred and problems that could have occurred. All right. And so, and of course, this would allow us to look at these issues, determine what their root cause is, again, so that, maybe policies and procedures need to be updated. Perhaps they're not up to date as far as evidence-based practice, or not adhering to the standard of practice, if you will. All right. Now, just as the RN established a trust and rapport with patients, he or she should also strive for the same type of supportive relationships with staff members as well, right? And again, this just makes it so much easier for people to do their job, and for us to have as near perfect as a work environment as possible. It won't be perfect ever, but we can certainly strive for it, which means that less issues will be prevalent on our units, which means patients will have great outcomes for the most part. All right. Now, the delegation process is not complete until the RN reassesses the patient and adjust the plan of care as indicated. All right. As I mentioned earlier, we cannot delegate the task to someone, walk away from it, and don't deal with it again. We have to reassess the patient, and of course, based on that assessment data that is collected, it might tell us that we need to adjust our plan of care because maybe something is not working, and we need to revise our plan. And this is what the nursing process is about, right? The RN should also provide honest feedback to the delegatee about his or her performance. I know that's difficult to do sometimes, but it's all in the way of being professional, being tactful, and speaking to people obviously in a way that you want to be spoken to. An easy and although often overlooked delegation skill is to praise good performance. And we should always praise someone. Sometimes I've told assistant personnel, we couldn't do this job without you. Can you imagine how that makes a person feel? You really did a great job. Praise people for what they do. I mean, you know how we all feel, that positive reinforcement, if you will. Often more difficult for the RN and sometimes ignored is the duty to address poor job performance. If someone is not performing well, and especially if it's their performance can lead to adverse patient outcomes, we have to address these issues. Right, we have to have this discussion with the delegatee. Otherwise, if you let this person just keep going on, they may very well cause harm to a patient. Now, the RN should tell the staff member about mistakes in a supportive manner. See, it's all in how you do it. You also want to do it in private. You don't embarrass someone. You don't say it in front of the family members and the staff and everyone else. Pull them aside. With a focus on learning from mistakes. Make it a learning or constructive criticism, a learning opportunity, right? However, if the staff member performs in an inappropriate, unsafe, incompetent manner, the nurse must intervene immediately. This is not something you wait and say, well, I'll let them do whatever they're doing with the patient. Something you notice is unsafe, and I'll talk to them later. But this is something that must be addressed immediately. You must intervene immediately and stop that unsafe activity, right? And document the facts of the performance and report to the supervisor. All right, that's the uncomfortable part. In addition, the nurse should report additional training or other appropriate action for the staff member to ensure that patient safety is protected. And maybe that's what the person needs. Maybe the task that they were performing, the unsafe task, they just did not receive adequate training on, and therefore they should be allowed that opportunity. The RN has a professional responsibility to intervene appropriately when poor performance is observed. All right. Well, folks, I think that's it. That really didn't take that long, but again, this will allow us to have a discussion, continue our discussion in class without having to rush, of course. And this one is actually under an hour, so that's not bad. And I will get this to you guys as soon as possible. Thank you.